Well, hello, this is Erika Hood again from the Center for Reducing Health Disparities, and I'm excited today because we have another community spotlight to share with you all with Diane Mastnardo, and she is a longtime friend of the Center for Reducing Health Disparities, having been a part of the CRSI cohort number 2. So she can talk a little bit more about her experience with CRHD and a little bit about who she is and what she does. So welcome, thank you.
Thank you, Erika.
No problem.
So yes, I kind of got involved with the Center for Reducing Health Disparities as a kind of just inquiry about wanting to know a little bit more about research and how it works as a massage therapist. And slowly but surely, I lingered around enough to get involved with the CRSI cohort 2 and got to do some research on massage. And Center for Reducing Health Disparities also helped me start the group that we're doing, which is the Massage of Northern Ohio Practice-Based Research Network, to work on improving access to massage therapy, to conduct research on massage efficacy, and then help educate the public, healthcare providers, and policymakers about massage.
Right.
So that's what we're trying to do.
Cool. So personally, you've been in the massage industry and you have a wonderful business, and we would like for you to share kind of what it is that you do and why you're so passionate about the work that you do.
So I've been doing massage since 1999, and one of the things that I realized is it really connects us to our bodies. And over the years, I've learned more and more about the complexity of our body as well as the simplicity. And I find a lot of times in healthcare, we're always looking at what's wrong with us, and we don't go to the doctor until we're broken. And I deal with a lot of unresolved cases. So people have tried everything else and nothing works, whether it's back pain or neck pain or things like that. And what I realized is it's not always that the other things don't work. It just might not be in the order in which they are receiving services. And I think people don't always bring it inside. So with massage, we can physically connect people to their bodies to look inside of what they're feeling, what they're noticing, and then they gain more agency in their healthcare. So that's kind of what we're doing, so touching people in a time of COVID makes it a little difficult at times.
Yes, how has that shifted for the industry of massage as a whole? I mean, we were all hands off across the board. So what does that look like for people who were receiving care, who had now had to have stopped their services, and as that industry kind of reopened?
So it's been an interesting thing. I think it opened the eyes of a lot of people in our industry, and we've done a deep dive into the research and the knowledge that we have, realizing that we aren't really front care, like we're not emergency needed care. So there was a huge pause, definitely paused. The state closed us down on May 17th, I believe, May 19th, or March 19th. Mm-hmm. And then we were able to reopen in May 15th, but the issue was we have massage spas, and then we also have people that do medical massage. So people really do utilize us as part of their care plan, especially if they have chronic pain and chronic health conditions. So it's been interesting to look at all the policies and procedures that we put together with cleaning and making sure, like taking temperatures now. And, you know, I think it's been a good thing for us to see that we need to have levels of engagement for massage. And it's made people, what I've found from some of the people that I work with is they're like, wow, I really realize how much this is part of my healthcare, because my back pain is back to where it was 5 years ago because I'm not able to do the things. And then people's mental health. So massage is also really good for mental health and inducing those endorphins and things. And that physical connection has been difficult. So I think it's opened a lot of people's eyes of the need and value of massage as more than a luxury.
Yeah, so, I don't think there's probably one person who has walked away from massage like, ooh, oh, that was nice. You know, you always walk away and you're like, I feel really good. Why don't I do this more often? You know, how can I incorporate massages into like my just self-care routine, period. But
right.
yeah.
That's one of the things we'd love to see is, you know, if we're looking at preventative care, if people got massages once a month, it would be like, you know, we get oil changes for our car, we get tune-ups. If people got massages, they would understand when things don't feel right, or we can create that communication of body awareness, which is huge.
Body awareness is huge. You know, if you go to a checkup or routine appointment and you have something that's kind of off, or you feel a tweak and they're like, well, how long has it been that way? Like, I can never answer those questions because I just don't, I'm not in tune with my body. I don't know. I know
tune it out.
Wrong. Yeah. But it's like, I can't even tell you when this kicks in, if this was ever like this. So I think that is very important.
Yeah, and I think COVID has also brought that to the forefront too. We've done a lot of mental health awareness, like, you know, we do mindfulness, we do meditation, we do yoga. And so those are all great, but if you don't connect it on how it feels in your body and what's going on inside your body, kind of missing that piece of mind-body awareness. And it'll be interesting to see post-COVID, or as we find this new normal, how people become more aware of those sensations. And one of the programs that we started through this is we did a pilot to help kids, because feeling like kids might have a opportunity to connect to their bodies at a younger age instead of waiting until we're broken. So we're teaching breathing, aromatherapy, acupressure, and movement. We call it BAM, so that we can use our senses. Like, we have everything we need within inside ourselves to connect into our natural healing potential. And just noticing when you breathe, like taking a deep breath in and then letting it out, that connects your brain to your body, and it flips a switch in your brain to go from fight or flight to rest and relax. Mm-hmm. And letting kids know we naturally do these things to really build that agency up, I think could be beneficial in this time.
And how well, this was pre-COVID that this started?
Yeah, so we started, we did a pilot, I think it was in 2017 or 18, in Lorain County Public Schools of 5th and 6th graders, where we taught it 5 minutes a day, 2 to 3 times a week for 8 weeks. And it was pretty cool. There's like a 19% decrease in disciplinary action in this school system, or in this group of kids from the other. And their attendance actually, that was an interesting thing that I just thought of, is, so the attendance was higher for the kids that were involved in BAM than the other 2 groups of students in the school during when there was a lot of sickness. There was a lot of flu and kids were out. This group had a higher attendance. So how do we tap into this again in COVID to help build our immunity and not just block everything out?
Yep. That's right. So, you know, I think it took me longer in life to realize just how valuable self-care was and mindfulness. Maybe in my 20s, I was just like, you know, hey, stuff rolled off my back a bit easier. The more you become aware of environmental and social conditions, you know, things kind of become heavier. So as a young person, can you see that they get it? Do you think that they get the value of this at such a young age?
They totally got it. So we have a whole bunch of qualitative data. So because I was part of the CRSI cohort 1, I set this up knowing that at some point in time I wanted to do research, even though I don't really have the resources to do that. So we have pre and post surveys. We had a independent person from actually Tri-C, one of the professors in the massage program, came out and sat in the classroom to see if we were doing what we said we were going to do. And he was amazed at, you know, he was like, oh, 5th and 6th grade kids, especially boys, aren't going to be involved in this. But they were raising their hand, they were engaged. And what I learned, so my son was going to the school, but he wasn't in the program, but he learned about it from his friends on the school bus. Like, they were talking about it, and then he was like, well, that's my mom doing it. So, you know, it's like, when I'm doing it, it's not a big deal, but he heard it from his friends. 2 of the kids actually, they taught the breathing and aromatherapy to their child psychologist. And so now she connected with me, and she's referring some of the kids to massage therapy to complement their psychotherapy. And then they were teaching their parents. So a lot of parents would come up to me and be like, hey, my son just brought this aromatherapy home. We do aromatherapy in the house. So I think it validated some of these natural things people are already doing. And it was pretty awesome to see. And I would love to do a longitudinal study with these kids to see how they help with impulse control and emotion regulation and just comfort in their bodies.
Yeah, that's huge. And I was just thinking, I stumbled across a primary care doctor who values like holistic care and wrote out prescriptions for
yes.
Oil diffusers and just going outside and connecting with the earth, different things. So when it would be awesome in America to see the care kind of merge, as far as like the medical clinical side of things and then this holistic approach that can complement each other.
Right.
So how do you guys talk about that?
That's what I'd love to see. So one of my goals and things that I would really like to do is connect with CMSD, so the Cleveland Public Schools, and Metro Health has the school health program. And how about if we educate people about their bodies? Currently, we have school health programs and physical ed, but we really don't teach kids about their bodies. We tell them what not to do. We tell you not to smoke, not to drink, not to do this. Yeah. But we don't talk about, what you can do for your body. So just doing like an acupressure point, right? So there's a point, we called it the superhero point in our program, where it's like right on your sternum, center of your sternum, and you can press in here, and then you just taking a deep breath in through your nose and then holding it and exhaling. And doing that a couple times, and how does that make you feel? Like, one of the things here with this too is like, so if I go to my side and we sit like this a lot, right? Our shoulders are folded. If you place your hand on this point and you lift it up to the sun, notice what happens with my shoulders naturally. Mm-hmm. They go up and they can drop down, versus if I'm here, pull your shoulders back. Well, that's still bad body mechanics. And then think about walking through the world. If you walk through the world with your shoulders hunched versus you walk into a room with your shoulders up, how you present yourself really helps. And there's a neurobiology connection and neuroplasticity that kids have naturally. And I think we don't encourage that. Like, one of the things that I find interesting with research, and especially with disparity research, is spend a lot of time researching what's wrong versus what's right. Like, what do people do that makes them feel good? And how do we build that up? Yeah. And put money into that, because the other stuff will trickle down.
Yep.
So
a general question for me is, so mid-May, the massage industry began to open back up to services. What have you seen as far as like the changes and guidelines that are taking place now that you're like, why didn't we do that before? A lot of things that have changed, many people are commenting like, this is great. Like, we should have always done this, in the industry where you guys are so close physically to someone else. Like, are there things that you will take away? You think that this is something that can be beneficial to the practice moving forward? Or has it been difficult to get folks to come in?
So it hasn't been really difficult. I don't know what I'd say. I mean, in reality, we did a lot of these things beforehand. It's like cleaning the table before. The big difference is wearing the mask. And so now we're taking temperatures before. So we have more objective data, maybe possibly, than before. But in my practice specifically, there's not a ton of difference because I am in a medical setting. So the cleanliness and things like that. I think the nice part now is, across the industry, the increase in standards that, massage therapists oftentimes would be like, oh, we can't do the standard because it's so personal and so unique and people don't understand what we do. We're starting to realize that there are some consistencies in what we do. Okay. And so I like that. So in my practice, not much different, but for the industry as a whole, I see a huge opportunity for us to understand the benefits of true, like, community-based research. What is it that we're doing in our practices that works? What might not be working? And how can we help each other be more effective and efficient?
So I know you mentioned disparities, and of course we're the Center for Reducing Health Disparities. Is there a disparity in who gets massages? Like,
Massages?
Yes. What does that look
Absolutely.
like as a whole? Who's coming to get massages, and what can we do to kind of tap into those audiences or groups of people who don't?
So in general, like if you look at integrative health in underserved populations, I'm currently on a systematic review. These are only done, if you're looking at underserved populations, it's done when there's like research money and things, and they show that it's beneficial, and then it dies away. I mean, how many massage clinics are in the Huff neighborhood where people could possibly get it? Where are they around the areas? So there's a disparity. Massage therapists think, you know, we're not looked at as the same level as other medical care. Well, I also feel like we're not in the areas where we could be beneficial, as well as the fact that I think culturally, a lot of people do give massages. So I recently heard a podcast about, it's the person that wrote My Grandmother's Hands. His name's Resma Menakem. And it's my grandmother's hands, racializing trauma and the pathway to mending our hearts and bodies, and how we all have trauma within our bodies. And just like he used to rub his grandmother's hands. And I think, so my research study with my research program was the perceptions and barriers to massage. And what we found is we did it in 5 clinics. The inner city clinics were just as likely to see massage as healthcare as a luxury. The difference was they were less likely to have massages done by a licensed massage therapist. It was friends and family. So they were getting massage, but as friends and family. And this is one of the things that I think could open up a job opportunity, is if we started training people within the community to give massage and to help each other heal each other. It could be very beneficial, but that's currently, it's just not there because the access and affordability isn't there on either end. So if it became, like you said, a prescription and it was part of your health care dollars in that, it would be very interesting to see building community. And that's one of the things we'd like to do with BAM, right? Start with BAM, teach kids, because it's everything you have within yourself. And as they become more aware of that, hopefully they can do the paradigm shift in healthcare where it truly is healthcare and not sick care. We're not waiting till we're sick to go and get something. And the financial dollars will be there because we won't be spending it at the end of life.
What do you think the future for BAM is with uncertainty as far as the schools physically taking place in the classroom? Do you have virtual components, or have you been thinking about that?
We'd love to do some virtual components. So there's a lot of programs like BAM, not like BAM, but have components of BAM. And I'd really love to collaborate with things that are already out there. Actually, Goldie Hawn has the Hawn Foundation, and she started a program called Mind Up that she's doing in schools. And it talks about mindfulness in the brain and things like that. So I'd like to see that and connecting with maybe yoga studios and teachers. What we found, we can do some of it like virtually, but from the research, what shows is these programs happen and then they die out, or they're done, somebody wants 45 minutes. We need short sound bites in school as part of, like they have social emotional standards now in the Ohio Department of Health. I'm not sure people are really engaging in, are we meeting those needs and how are we measuring that? So the future of BAM, I think, is endless and has tons of possibilities. As a single person, I don't have the capacity to do that, but I have the capacity to hopefully collaborate with others to look at it in that way.
I like that. I mean, and I think essentially the collaboration will make it more sustainable over time.
Right.
So it's a good idea to look at it in the broader sense.
Correct. And so there's some other cohorts that I've connected with, some of the new pilot awardees. Elizabeth and I actually have a call later today to talk about some possible grants and connecting with CMSD, and she's done a program in the past with surfing and connecting to the body, so we can do like BAM and outdoor activities, and could be kind of fun.
That sounds fun.
Yeah.
I like that. what are some other things you would like to share during these, like it's summertime, the weather is great. We would love to just get outside and do summer like how we did in years past. You know, what are some things that you would want to share with community as far as in times where you're limited and maybe can't do some of the exercises or activities that you would have normally done to release? What are some cool things that we can kind of let people walk away with from watching this?
I think just noticing what you do have around you, like when you're breathing outside, what are you smelling? How does that feel in your body? Like, you know, the other day on Father's Day, there was a rainstorm coming in and those breezes and that smell of rain, and how does that feel in your body? And everybody might have a different sensation. And when you're walking in the world, think about, you know, shoulders up, chest out, those kind of things. How does that feel walking down the street like that versus down? Like, play with your body and the things that you have around you.
Yeah.
Notice when you get sore, like my hands will sometimes get sore. Like if you press on it, how does that feel? How does it feel to melt into your muscles instead of like sometimes we want to just like dig at it and attack it? How is it if you just slowly touch and see if those muscles will melt in, and be aware of what you're feeling under your fingers? And then movement, how does that feel? You know, to move versus sitting still and cross body stuff to connect your body. So I think it's been a great time for pause and really reconnecting with yourself and reconnecting with the world around us. So that's the positive in all this. So just enjoy what you have within yourself and around your surroundings.
I love that. I love that. Is there anything else you want to share with us?
No, just glad that the Center for Reducing Health Disparities is here and looking forward to a lot of the collaborations and things that are coming out of the center.
Awesome.
Thank you.
Thank you, Diane. When we post this, we will definitely link it to your information so that if folks have questions, I think you are a wealth of knowledge when it comes to this, especially if someone doesn't know anyone in the industry and may have questions to feel more comfortable. We can definitely link your site and services to them so that they can, you know, reach out.
Great.
This is
awesome.
Good though. I'm excited, and it's making me more mindful. When you were talking about posture, I'm like, let me straighten up and, you know, take things. I mean, it's so important because it makes you feel so much better. So just a reminder, this was good. I appreciate your time.
Thank you so much. Have a great day.
All right. Thank you.
Bye.